10 Weird Signs of a Fatty Liver. Ever wonder if your body is trying to tell you something important? Today, we're diving into the mysterious world of fatty liver disease, a silent threat affecting millions of people worldwide. Imagine waking up and noticing something odd, like yellowish skin or unexplained fatigue. Could these strange signs be clues to a hidden health issue? Fatty liver disease isn't just for the unhealthy, it can affect anyone, sneaking up with bizarre symptoms that seem unrelated. From sudden weight loss to changes in sleep patterns, your body might be dropping hints you can't afford to ignore. In this video, we'll uncover 10 of the weirdest signs of a fatty liver. These unusual symptoms might surprise you and could be the key to catching this condition early. Stay tuned to find out what your body might be trying to tell you, before it's too late. Don't miss this eye-opening exploration into the hidden dangers lurking in your liver. 1. Abdominal pain. If your belly's been giving you grief, it might be more than just last night's questionable takeout. Abdominal pain can be a sneaky indicator of fatty liver disease, and here's why you should pay attention. When your liver starts accumulating fat, it can swell, causing discomfort or even sharp pain in the upper right side of your abdomen. It's like your liver is waving a tiny white flag, trying to get your attention. According to a study published in the Journal of Hepatology, around 20% of people with fatty liver experience this kind of pain. That's a significant number, and it's not just a random tummy ache. Now, abdominal pain isn't always about your liver playing tricks. It can also be caused by a variety of other issues. Maybe you've got a case of the dreaded gas buildup, which, let's face it, is never fun. Or it could be something more serious, like gallstones or even an ulcer. But here's the kicker: while other causes of abdominal pain might come and go, liver-related pain often sticks around, nagging you like a bad song stuck in your head. So how can you tell if your abdominal pain is liver-related? Well, if it's persistent and located on the upper right side of your abdomen, it's worth getting checked out. Dr. David Bernstein, a hepatologist, suggests that chronic pain in this area, combined with other symptoms like fatigue or jaundice, could be a red flag for fatty liver disease. Let's not panic just yet, though. Remember, not all abdominal pain equals a fatty liver. But if your pain has been hanging around longer than your last Netflix binge, it might be time to listen to your body and seek some medical advice. After all, it's better to be safe than sorry, and your liver will thank you for it. 2. Fatigue. Let's talk about fatigue, the kind that makes you feel like you're dragging a ton of bricks behind you even after a full night's sleep. If you're constantly tired, your body might be trying to tell you something important. Fatigue can be a key indicator of fatty liver disease, and here's the lowdown on why you shouldn't ignore it. When your liver is overrun with fat, it struggles to do its job effectively. Think of it as a factory that's suddenly swamped with orders it can't keep up with. The liver is responsible for detoxifying your blood, producing essential proteins, and managing nutrients. But when it's burdened with excess fat, it gets overwhelmed, and one of the first casualties is your energy levels. A study published in the Journal of Clinical Gastroenterology found that fatigue is a common symptom among those with non-alcoholic fatty liver disease, NAFLD. This type of fatigue isn't just about feeling sleepy, it's a deep, pervasive tiredness that can affect your daily life. Dr. Michael Charlton, a hepatologist at the University of Chicago, explains that the inflammation caused by fatty liver disease can disrupt your body's energy production, leading to chronic fatigue. But let's not jump to conclusions just yet. Fatigue can stem from a myriad of other issues, too. Maybe you stayed up too late binge-watching your favorite series, or perhaps you're not getting enough vitamins in your diet. Yet, the kind of fatigue associated with fatty liver disease is often accompanied by other symptoms, like abdominal pain or unexplained weight gain, making it a more telling sign. So how do you know if your fatigue is liver-related? If you're constantly feeling exhausted despite getting enough rest and your lifestyle hasn't changed much, it might be time to consider your liver's health. Dr. Manal Abdelmalek, a liver disease expert at Duke University, suggests paying attention to persistent tiredness paired with other symptoms such as right-sided abdominal discomfort or changes in skin color. Fatigue can be a sneaky symptom, blending into the background of our busy lives. but if it's been hanging around longer than that awkward family reunion story, it might be time to check in with your doctor. 3. Jaundice. Let's get into something that might seem straight out of a horror movie. Imagine looking in the mirror and seeing a yellowish tinge staring back at you. Spooky, right? But before you start thinking you've turned into a Simpsons character, let's explore how this yellowing of the skin and eyes could be a sign that your liver is in trouble, specifically pointing towards fatty liver disease. Jaundice happens when there's too much bilirubin in your system. Bilirubin is a yellow pigment formed by the breakdown of red blood cells, and it's usually processed by the liver. When your liver is overloaded with fat, it can't do its job properly, leading to a buildup of bilirubin in your blood. This gives your skin and the whites of your eyes that distinct yellow hue. Think of it as your liver waving a giant yellow flag, screaming for help. According to a study published in the Journal of Hepatology, jaundice is a significant indicator of liver dysfunction, including fatty liver disease. Dr. Nancy Rowe, a hepatologist at Rush University Medical Center, explains that when the liver is clogged with fat, it can't effectively process bilirubin, resulting in jaundice. It's like a traffic jam in your liver, and the bilirubin is stuck in gridlock, causing a yellow backup. Other conditions can also cause your skin to take on that not-so-fashionable yellow shade. For instance, it can be due to hemolysis, a condition where red blood cells are destroyed faster than they can be made. If your friends start asking if you've been using too much turmeric in your diet because of your yellow skin, it's definitely time to see a doctor. Remember, your body has a way of communicating when something's not quite right, and jaundice is one of those unmistakable signs. 4. Unexplained weight loss. Might sound like a dream come true for some, but when the pounds start dropping off for no apparent reason, it's time to take a closer look. While shedding weight without trying might seem like a blessing, it could actually be a sign of something more sinister, like fatty liver disease. When your liver is struggling with an overload of fat, it can't process nutrients effectively, leading to a host of metabolic issues. This can cause your body to break down muscle and fat stores at an alarming rate, leading to unexplained weight loss. Imagine your liver as the central processing unit of your body's nutrition management system. When it's overloaded, everything starts to malfunction. According to a study published in the American Journal of Gastroenterology, unexplained weight loss is a notable symptom in patients with advanced stages of fatty liver disease. Dr. Rohit Lumba, a hepatologist at UC San Diego Health, explains that as the liver becomes more compromised, it starts to affect the entire metabolic system, leading to significant weight loss even if you're eating normally. It's like your body is on a forced diet without your consent. But let's not jump to conclusions just yet. There are other potential reasons for unexpected weight loss. Stress, hyperthyroidism, and gastrointestinal issues can also cause you to shed pounds without trying. And let's be honest, who hasn't wished for a magical weight loss solution that doesn't involve hours at the gym? But when it's your liver at the helm, it's definitely not the kind of weight loss plan you want to be on. Dr. Catherine Frenette, a liver specialist at Scripps Clinic, advises that any significant and unexplained weight loss should be thoroughly evaluated by a healthcare professional to rule out serious underlying conditions, including fatty liver disease. If your clothes are falling off you and you haven't hit the gym in months, it's probably not because you've suddenly developed a super metabolism. Your liver might be waving a red flag, or perhaps a shrinking wardrobe is trying to tell you something. 5. Nausea. Let's talk about nausea, the kind that makes you feel like you're on a perpetual merry-go-round after a hefty meal. If you're constantly fighting the urge to hurl, it might be more than just a bad burrito, it could be your liver trying to send out an SOS. Nausea is a common but often overlooked symptom of fatty liver disease. When your liver is overwhelmed with fat, it struggles to function properly. This dysfunction can lead to an accumulation of toxins in your body, which can make you feel nauseous. It's as if your liver's way of saying, hey, something's not right here, is by making you feel perpetually seasick. A study published in the Journal of Hepatology found that gastrointestinal symptoms, including nausea, are prevalent among individuals with non-alcoholic fatty liver disease, NAFLD. Dr. Stephen Harrison, a renowned hepatologist, explains that as the liver's ability to process and eliminate toxins diminishes, These toxins build up in your bloodstream, leading to symptoms like nausea. It's like your liver is hitting the overload button, and your stomach is paying the price. But nausea isn't exclusive to liver issues. It can also be caused by a variety of other factors, like food poisoning, migraines, motion sickness, or even pregnancy. However, when nausea is persistent and accompanied by other symptoms such as fatigue, jaundice, or unexplained weight loss, it's a strong indicator that your liver might be the culprit. If you find yourself feeling queasy more often than a contestant on a spinning wheel game show, it's time to think beyond bad food choices. Your liver might be giving you a not-so-subtle nudge that it needs help. 6. Swelling in the abdomen. Let's tackle another unsettling yet crucial symptom. If your belly starts to resemble a balloon that's had one too many puffs, it might be more than just a post-buffet bloat. Swelling in the abdomen, also known as ascites, can be a telltale sign of fatty liver disease, and it's definitely something you shouldn't ignore. When your liver becomes fatty and inflamed, it can lead to increased pressure in the blood vessels surrounding it. This pressure causes fluid to leak into the abdominal cavity, resulting in noticeable swelling. Imagine your liver as a sponge that's soaked up too much water and is now dripping all over the place, except in this case, it's fluid accumulating in your abdomen. According to a study published in the Hepatology Journal, ascites is a common complication in patients with advanced liver disease, including fatty liver. Dr. William Carey, a hepatologist at the Cleveland Clinic, explains that as the liver's function deteriorates, it can no longer regulate fluids properly, leading to fluid buildup in the abdomen. This can cause not only discomfort but also a visible swelling that makes you look perpetually bloated. If you notice persistent bloating that doesn't go away and is accompanied by other symptoms of liver dysfunction, it's time to consult a healthcare professional. If you're feeling like you've swallowed a watermelon whole and it's not even summer yet, your liver might be the one to blame. It's like having a built-in food baby that just won't quit. 7. Enlarged liver. Alright, let's dig into the next strange sign of fatty liver disease, an enlarged liver, or hepatomegaly if you want to impress your friends with some medical jargon. An enlarged liver might sound like something out of a sci-fi movie, but it's a very real and potentially serious symptom. When your liver becomes overloaded with fat, it can swell and grow larger than its normal size. Think of it as your liver turning into a storage unit that's bursting at the seams. According to the American Liver Foundation, fatty liver disease is one of the leading causes of an enlarged liver. As the fat accumulates, it causes inflammation, which makes the liver expand. This enlargement can sometimes be felt as a fullness or mass under your right rib cage. Dr. Rohit Lumba, a leading hepatologist, explains that an enlarged liver can be detected through physical examination or imaging tests like ultrasound or MRI. If your doctor pokes around and comments on the size of your liver, it's not just small talk, it's a crucial diagnostic clue. So how do you know if your liver is trying to channel its inner Hulk? If you feel a persistent fullness or discomfort in the upper right side of your abdomen, it might be time to get it checked out. Dr. Nancy Rowe, a hepatologist at Rush University Medical Center, suggests that any noticeable change in liver size warrants a thorough medical evaluation. If you start feeling like there's a small football lodged under your ribs, it's not because you've developed a secret talent for swallowing sports equipment. Your liver might be trying to tell you it needs some attention. 8. Dark urine. Let's dive into a symptom that might make you do a double take next time you're in the bathroom. It sounds like something straight out of a horror story, but your urine color can actually be a vital clue to your liver's health. If you've noticed that your urine has taken on a darker hue, it could be a sign of fatty liver disease, and here's why. When your liver is bogged down with fat, it struggles to process and eliminate bilirubin, a yellowish substance produced during the normal breakdown of red blood cells. Normally, your liver filters bilirubin out of your blood and excretes it in bile. However, when the liver is overwhelmed, bilirubin levels can rise, and this excess can spill into your urine, giving it a dark amber color. Think of it as your liver's way of sending out an SOS signal through your kidneys. A study in the Journal of Hepatology found that dark urine is a common symptom in individuals with advanced liver disease, including fatty liver disease. Dr. Michael P. Manns, a hepatologist, explains that dark urine, often accompanied by jaundice, is indicative of liver dysfunction. It's like your body's very own color-coded warning system, letting you know that something's amiss. But, before you jump to conclusions and start panicking every time your urine looks a bit off, remember that dark urine can have other causes too. Dehydration is a common culprit. When you're not drinking enough water, your urine becomes more concentrated and darker. Certain foods, like beets and fava beans, and medications can also cause changes in urine color. However, if dark urine persists and is accompanied by other symptoms such as fatigue, abdominal pain, or jaundice, it's time to consider your liver health. If your urine looks more like cola than lemonade, and you're pretty sure you're not a walking soda fountain, it might be time to think about your liver. 9. Pale stool. Alright, let's talk about a symptom that might make you take a second look in the toilet. It's not the most glamorous topic, but paying attention to the color of your stool can provide crucial insights into your liver health. If you've noticed that your stool is lighter than usual, it could be a sign of fatty liver disease, and here's why. Your liver produces bile, a dark green to yellowish-brown fluid that helps digest fats and gives your stool its typical brown color. When your liver is overloaded with fat, it can impair bile production or block bile flow, leading to pale or clay-colored stool. Imagine your liver as the paint mixer at a hardware store. If it's out of commission, everything turns out a bland shade of beige. According to a study in the Journal of Clinical Gastroenterology, pale stool is a common symptom in patients with liver and biliary diseases, including non-alcoholic fatty liver disease, NAFLD. Dr. Cynthia Levy, a hepatologist, explains that pale stool occurs when bile ducts are obstructed or bile production is insufficient, preventing the normal coloration of stool. It's like your digestive system is missing its usual color palette. Stay tuned as we continue to uncover more strange symptoms that could indicate a fatty liver. You won't want to miss what we delve into next on this fascinating journey. 10. Confusion. Let's dive into a symptom that can be particularly unsettling. If you find yourself feeling dazed and struggling to think clearly, it could be more than just a sign of stress or lack of sleep. Confusion can be an alarming indicator of fatty liver disease, and understanding why this happens is crucial. When your liver is bogged down by excess fat, its ability to filter toxins from your blood diminishes. One of the liver's primary roles is to detoxify the blood and break down harmful substances, including ammonia. When the liver can't do its job properly, these toxins can accumulate in the bloodstream and eventually reach the brain, leading to a condition known as hepatic encephalopathy. This condition can cause symptoms ranging from mild confusion to severe cognitive impairment. A study published in the Journal of Hepatology highlights that hepatic encephalopathy is a serious complication of liver disease, including non-alcoholic fatty liver disease, NAFLD. Dr. K. Rajendra Reddy, a hepatologist at the University of Pennsylvania, explains that as the liver's function deteriorates, toxins build up in the body and impair brain function, leading to confusion and other neurological symptoms. It's like your brain is getting clouded by a fog of toxins that your liver should have filtered out. But let's not jump to conclusions just yet. Confusion can arise from a myriad of other causes as well. Dehydration, infections, low blood sugar, and even certain medications can all lead to temporary confusion. However, if this symptom is persistent and comes alongside other signs of liver dysfunction, such as jaundice, dark urine, or abdominal swelling, it's a strong indication that your liver might be in trouble. If you're feeling more scatterbrained than usual and your confusion seems to come out of nowhere, it might not just be because you forgot where you put your keys again. Your liver could be sending you a not-so-subtle nudge that it needs some attention. And there you have it, 10 weird signs that your liver might be waving a red flag. From unusual abdominal pain and persistent fatigue to that unsettling yellow hue and even confusing brain fog, your body has its own unique way of sending out distress signals. Remember, catching these signs early can make all the difference in managing your liver health. We hope this video has been as enlightening as it has been eye-opening. If you found these insights helpful or even a bit surprising, don't keep it to yourself. Hit that like button, drop us a comment with your thoughts or experiences, and share this video with friends and family who might benefit from this information. And if you're new here, don't forget to subscribe for more fascinating health tips and updates.